About topic, we have with us Mohd FazliShuib, former board member, Pharmacy Board of Malaysia, ASQUA faculty, with more than 25 years of experience from hospital commissioning to managing business operations to quality management. He is a frequent speaker on both local and international meetings. I request you, sir, to please start the session.
Hi, good evening, everyone. Thank you, organizer and Kaho, for this opportunity. Among the last speaker, because probably a lot of things been covered. Okay, the topic of my sharing is basically best practices in medication management. But I'm not going to share a specific best practices, but rather than try to give us some key principle on how things can be done, in particularly for the hospital setup. All right. So this is like my current hospital now, AV Hospital. We have been accredited by JCI for 3 times since 2016. So some of the key points is basically from JCI as well. Okay. So these are the things that I will be covering. All right. This is just to emphasize why we are here today, talking about the medication safety and all these safe practices, because every person in the world, at one point or another, surely be taking medication. There are multiple healthcare involvement, right? It's a very complex process. Usually, I will just share with people. I mean, if you are walking along the street, suddenly you got a headache, right? So you can just pop up into 7-Eleven or any shop, take 2 tablets of paracetamol, a water, just drink. That's it. Maybe 1 or 2 steps, you can get the paracetamol into the body. But when we are talking about in the hospital, right, it's a very complex process, right? From the purchasing to the, even before purchasing, selection, purchasing, the doctor have to prescribe, the pharmacy have to dispense, the nurses have to administer. So it's a very complex. So this itself open up to a lot of opportunity for error. All right. And the other thing, medication has always been a critical component in the patient treatment. And with that, there are a lot of unsafe practices. Okay, so when it comes to the, what do you call this, key principle for safe medication practices, I think this is what we need to emphasize. We already moved from being a very departmentalized, like pharmacy, doctor, nurses, and nurses. We already moved towards a multidisciplinary, right? Of course, pharmacists will still lead the whole thing, but you have to be involved everybody else, including people from the quality, even people from the ICT, and even the administration, because for every single medication process, it's been looked differently by a different stakeholder. So we want to actually combine the unique knowledge of each of the team member. And we have to make sure also that all this medication management works well from end to end. I mean, if it's in the hospital, from the time that the patient being admitted until the patient being discharged. So how to do that? So this is where we are saying that you have to be managed in the smarter way, not just as a pharmacy. Because in the hospital setup, for example, right, or even in the broader setup, pharmacy just one portion. Usually, pharmacy is well taken care, because this is our pharmacist strong or safe territory. But what is happening outside the pharmacy, there is always been a challenge. All right. So this is why all the medication need to be organized as a system, not just as one department or another department. So if you can see from the slide here, I mean, it starts from this process from the beginning, from the selection, procurement, right to the monitoring. So it's a cycle. Individuals, committee, everything, we need to have a very clear roles and responsibility being defined, right? From the top, right to the bottom, right? So there could be some specific responsibility, there could be shared responsibility, there could be a delegated responsibility. But in all, pharmacist is the leader when it comes to the medication management. So that have to be very clear. I think this is where accreditation body like JCI, for example, they really emphasize on the pharmacist leadership. So wherever there is a medication, pharmacists have to lead. So as simple as that. So that actually empower the pharmacist to actually do what is right, do what is appropriate. And of course, we always be guided by law as well as the professional standards of practices. This is again not just to include, but we need to have all the policy in place and so on. All right. These are the, it's not a endless list, but these are some of the well-known. For example, ISMP is the organization that you should be close to, because there are a lot of safe practices, because I can see someone were asking about what is a tall man lettering. So look alike, sound alike. So there are many things that have been mentioned in the ISMP, all right? So you can go and have a look. Even if you are looking on how to actually come up with a good reporting system for medication error, I have been using all my life this NCC MERP, which is a very structured, very straightforward, and a few other things. So this is some of the references that you can actually go and have a look. All right. This is a classic 5 rights, right? That everyone of us know, right? But as we know, also having a 5 right is good. But when it comes to the medication administration, right? We need the 6, 7, or even more. This is the reason why some of the organization or some of the hospital, they have moved beyond 5, because 5 is just very technical, something that is very technical on the prescription, for example. But when it comes to the administration, you need the right response, right documentation, and so on. So like in our hospital, we move on with the 7R, right? From the 5, right? So when it comes to the administration, so right after they have administered, so the nurses will need to check on the right response, right? So for example, if the medication is a pain medication, so does the pain score reduce after the medication being given? If it's a anti-diabetes or insulin, what about the glucose? So if it's a anti-hypertensive, does the blood pressure been managed? So those are the kind of thing, and of course, a right documentation. Okay, so is a right documentation is also very important, because if they delay in terms of the documentation, for example, they have given but they don't document, so the next nurse probably will give it again and become a medication error. This is another part, right? When we talk about the best practices, it's not just within us, the healthcare provider. This is what we actually pushing now. It's about the patient engagement, right? So as far as the patient engagement, I think at the beginning, the organizer also mentioned about the patient engagement. So this is where something that's been recently introduced, the 5 moments for medication safety. So this is the opportunity to bring the patient into the medication management system. All right. These are a few key points when they are actually starting a medication, when they are actually taking a medication, when they're actually adding a new medication, reviewing the medication, as well as stopping medication. So there are specific questions. Again, this is something that you can Google. You will find 5 moments for medication safety. So for example, when they're actually starting a medication, they need to know, right? What is the name? What is it for? What are the risks? What are the side effects? So when they're actually stopping, when should they stop, right? Do I need to stop? So these are the very specific questions that we can actually educate and encourage the patient so that they actually be part. Because the problem with the medication errors sometimes, because the patient, they are actually sitting outside of the system. They just wait for things to happen. They just wait for things to be served, right? So they are not really involved. So we want to bring them to be involved in their own medication management. Moving on, when we talk about what do you call this, medication safety best practices, right? I think nowadays we cannot run away from healthcare technology. We cannot run away from automation, right? But be careful, because we cannot be jumping into every single technology that is available. So we need to be smart, right? We need to know, right? So basically, just to put straightforward, for example, there are studies to say that if it's only one technology, right? So it's a little evident to actually show that it can reduce a medication error or even adverse event. For example, if you were to take if you are implementing a CPOE, right? CPOE, which is a physician, computerized physician order entry. CPOE with and without clinical decision support, they are two different things. Because if a CPOE without the clinical decision support, it's just something the doctors are putting in, right? So it does not stop the doctor from making any medication error to some extent, because when we put the clinical decision support into the CPOE, that become a lot more useful. Okay, so this is where you can see in terms of the medication error reduction rate, it can be between 26% to 81%. It depends on the implementation. And we need to be careful. We need to be this one, because technology is not the cure for everything. We still need the human, we still need the policy, we still need the processes. So this three combination is a very crucial. That's why I'm always what do you call? I always emphasize to understand the principle, to understand the concept, rather than trying to find what is the best tool, what is the best system, this and that. Because without understanding the principle and the concept, I think no technology can actually help you. All right. So nowadays there are a lot of technology, but to know which technology, then you need to decide for yourself. But first of all, right, these are all the things that is available now. Of course, if if money is not an issue, you can implement all. I'm sure you can have all of it. For me, I'm fortunate, right? Over the last 20 over years, right? I have been able to actually, in my previous hospital, especially in Malaysia, I've been able to actually implement it all except the robotic compounding and the dispensing cabinet. Even now in current hospital also, we have moved up to the barcode medication administration, whereby if you know, they do a bedside barcode verification before drug administration. So to know which one, right? As I mentioned, is money is not an issue. You can have all, but if the budget is limited, so where can be applied? So we go back to this very old paper, but still relevant. So where the error can happen, right? Basically at the ordering, transcribing, dispensing, administration. So these are the three key areas that we want to actually focus on, right? No need to spend money on the robotic compounding if we do not have a proper system for the prescribing, then proper system for the dispensing. So we have to be a bit smart on how to use our resources. So this is what I mentioned, right? For example, physician order entry and so on and so on. All right. Ultimately, all right. Ultimately, what we want to achieve with all this technology, this is another term, what we call as a closed loop medication management or closed loop medication administration system. All right. Basically, it's an end-to-end electronic medication management, which means from the time the doctor prescribe from the system, the pharmacist review electronically, right? Dispense electronically. It goes to the nursing station. The nurses administer electronically. So everything become a complete. So this will support a lot on the monitoring. So we can do it seamlessly from the pharmacy, from everywhere. The doctors, the nurses, almost everybody can look at the same record simultaneously. Then the patient will actually benefit a lot. So this is, I mean, later on I will share the slide if you can read a lot more on this, but this is something to also trigger. And even after this session, if there are questions, I can take a couple of questions. All right. So this is how it looks like. Basically, it's a, if you see, it's a loop, all right? So it's a closed loop from the time that, from the time the doctor do the assessment, the doctor prescribe, goes to the pharmacy, do the online verification, go to the nurses. So the information and the data are maintained inside the system. So take home messages, right? The key thing, right? When we talk about the best practices, I mean, you have to be evidence-based. We are lucky enough nowadays, right? Probably not like 20, 30 years ago, all right? Nowadays is Mr. Google is here to help us, right? But you need to be able to find where it is. But on top of that, pharmacists, you are the key, right? The knowledge, the education, the credential that we have learned during our undergraduates, right? That is a very crucial. So this is just some of the key things, right? In terms of the policy development, in terms of coming up with the medication practices, quality assurance. For example, like for the medication safety, like in my hospital now, what I have done, I have even created a medication safety pharmacist to have a very dedicated resources, because usually the hospital will actually have a patient safety, but patient safety is a very big, and usually they will focus a lot more on other things rather than just a medication safety. So in my hospital, of course, we have patient safety, but I also have a medication safety pharmacist who be looking at all these initiatives, as well as looking at the medication errors, how to improve this and that. Check on utilization, right? Monitor usage. Basically, everything got to do with the drugs. Pharmacists, we need to be involved. There's no issue on that. Okay, so I guess that's all from me, right? This is again, I just mentioned just now, this is to trigger and to make sure that we are starting on the right foundation, the right principle, especially some of us who have the power, who have the authority, right, to make things happen, right? So these are the kind of thing that we should be doing from the beginning. All right, that's all from me. Thank you.
Thank you, sir. Thank you for a very informative session.